Getting diagnosed with ulcerative colitis at age 27. So it all started back in February. I was experiencing bloating and constipation for a few days. And, once in a while people get constipated, right? But it just was not relieving itself. And then I started passing mucus, and I've never had that problem before. I also noticed there was a tiny bit of blood in my stool, but I thought, I probably have a hemorrhoid. I've had a hemorrhoid before, but at the same time, I had no pain as when I did have a hemorrhoid before. So there was no pain, just passing a tiny bit of blood and mucus, and I was very constipated for a week. So I go to my primary care, and she's like, you probably just have colitis. And I don't know what colitis is. I don't really know anything, but I told her my mom has diverticulitis, blah, blah, blah. She's like, here's antibiotics. And I said, well, I'm not taking those unless you know that I have an infection, because I don't like taking a lot of medicine, and what if I don't need it, So she's like, okay, well, there's something I can do for you. You can see a gastro doctor, but your symptoms will probably go away before you even get in. And I'm like, okay. So then I do research, and I just find my own gastro doctor. She gave me a referral, but it was hard to get in. So I found someone, got in. He suggested a colonoscopy, did a colonoscopy. And, I had to wait about a month before I got the colonoscopy. So, I just kept trying to relieve my constipation as much as possible. And there'd be days I'd be so bloated. My stomach was very extended. And my stool was thin and it had grooves in it. So I'm thinking the worst case scenario is, because I'm doing, research. I'm thinking I either have ulcerative colitis, or I have cancer, or, I'm thinking all these different things. I don't know what's going on, but I'm trying really hard not to freak out, even though the whole time I was freaking out. And so then I get the colonoscopy, and he's like, yeah, you have proctitis. You have very mild inflammation. And he did biopsies. So the biopsies came back, and they were, I guess, not showing that I had ulcerative colitis. And I'm thinking, it was too early on to tell possibly. So I'm like, well, what do I have? And he's like, doesn't really know. You have proctitis, you have inflammation of your rectum. And I'm like, okay, so what do we do? And so I try mesalamine as suppositories, and they do not work. I have an adverse reaction to them. I was on it for a week, and I started to see some improvement, and then all of a sudden things just got way worse. Basically all my symptoms just amplified, abdominal pain, I had diarrhea. So it was the reverse, I just wasn't even constipated. I was just having severe diarrhea and blood, so much more blood. Yeah. Then, he's like, okay, well, you can't take that. And I'm like, okay. So he puts me on hydrocortisone suppositories. And I did that for about 2 weeks, and it helped for a few days, and then it didn't help at all. It really just kind of managed some of the symptoms, I guess, of the blood and mucus, but really didn't do anything. And so he's like, okay, stop taking that. It's mostly for hemorrhoids, but I want to see if it would, help. So it didn't work. Then he's like, I think we should try the mesalamine again. Oh, well, before that, I did get another, not a colonoscopy, but a flexmoid scope, a sigmoid scope. I can't remember how to say it, but I got that done, and he said the inflammation has spread, and I'm like, okay. And so, it's still mild inflammation, but, you do have ulcerative colitis. So I'm just thinking it was too early to tell before, maybe the biopsy doesn't show, but he's like, he showed me all the photos, whatever. So I don't know, it's just very odd. But then then I tried the mesalamine again, but in an enema form. He's like, let's just try it again, and, don't use the whole bottle, just do half. Let's just see if it'll work. And I'm like, okay, I don't think it's going to work, but I'm going to try it because, what do I know? So then, I do it. And then the next day I'm throwing up, which is so odd, and just feel so sick. And while all this is going on, I'm under extreme anxiety and stress, because this is scary for me. And I don't like when my body's not working the right way, it just freaks me out. And it's also impacting my daily life. I don't feel well. So then I'm like, okay, well, what do I do? And so he puts me on prednisone. He did not want to do this. He really wanted to avoid putting me on prednisone. And I also have never been on prednisone. I always refused it anytime I've ever been prescribed it. But here I am taking it, and let me tell you, immediately, like within like 3 days, my symptoms started to improve. And as all this was going on, my symptoms slowly got worse as well. And I think because I was under so much stress, it got worse. And I just wish I could go back in time and like manage my stress better, because I don't know if that played a major role into it. Probably did. I mean, it still is, I think. But anyway, so on prednisone, he wants me to start mercaptopurine. And basically, mercaptopurine is a drug used in chemotherapy. And I was like, what the hell? Like, I do not want to take that. Like, absolutely not. And he's like, well, you know, like, then you find a medicine. You tell me, like, what you want to try. And I'm like, ugh, like, what do I know, you know? And I'm trying to do research, but everything sounds so scary. And, like, I don't know. So, okay, I'm going to give it a try. And he's like, you'll start off a low dose. We're going to have to monitor your blood work very closely for about 8 weeks. Every 2 weeks, you have to get your blood work done. Whether you see me or not, just make sure you get it done. Just to make sure, you know, I guess I can process the medicine properly, and then to monitor my liver function and my bone density, all these different things. I don't know. I still don't understand fully, but yeah. So I've been on it 50 milligrams for like 13 days. Then he increased my dose after some blood works that like basically said I was at low risk for developing serious side effects. And so increased my dose, but now I'm experiencing a lot of nausea, and I'm hoping it'll pass. And I'm just very worried about the long-term side effects. And I'm still on prednisone. I'm on 30 milligrams a day. I was on 40, but I couldn't tolerate how freaking crazy it makes me feel. And, you know, I still have symptoms. This medicine apparently takes at least 6 to 12 weeks to work. Some of my symptoms are better. I don't know if that's the prednisone or the medicine, so I guess time will tell. But it's just very hard mentally to be going through this, and to have to accept that I may have to be on medication for life. You know, I do want to try some holistic approaches, definitely try to incorporate that. And I have a dietitian as well. You know, my doctor did not suggest me getting a dietitian. I did that on my own. He actually didn't bring up diet at all, which I don't think most doctors do, which is crazy to me. But yeah, I don't blame my doctor for that. I just don't think that like they're trained about diet a lot, you know, unless you're super unhealthy. But I've generally been very healthy my entire life, other than my stress, which leads me to believe that my stress brought this on. But, you know, I literally feel like there's not that many people who post about ulcerative colitis compared to other things. And I don't know how common it is, but, you know, I've joined some Facebook group chats, everything like that, to try to connect with people and learn about the disease more. And it can be very overwhelming. I just hope that I can find a way to heal myself with as minimal side effects as possible, and to just live a normal, healthy life. You know, it's just really scary going through all this, and I just really pray to God that I can find healing, and that anybody else with this disease can find healing as well. If anybody sees this who has ulcerative colitis, if you want to ask me questions or know more, please, you know, comment or just message me. I feel awkward making this video, but whatever. This is just the best way I can explain it, I guess. If I wasn't clear on anything, just let me know. But yeah.